Niger's historic achievement, first African nation to eliminate river blindness. Welcome to the Bold African Voice, BAV, where we dive deep into Africa's most critical health and development issues. I'm Abdul Karim Kargbo, born and raised in Africa. Today we're celebrating a historic milestone. Niger has officially become the first African nation to eliminate Onchocerciasis, or river blindness. This achievement is not just a win for Niger, but for the entire African continent. Stay tuned as we analyze the factors behind this success, its impact on Africa's public health landscape, and what it means for the future of neglected tropical disease elimination. On January 30th, 2025, the World Health Organization, WHO, announced that Niger has become the first African country to eliminate onchocerciasis, commonly known as river blindness. This milestone positions Niger as a global leader in the fight against neglected tropical diseases, NTDs, joining Colombia, Ecuador, Guatemala, and Mexico in the exclusive group of nations verified by WHO for interrupting the transmission of the Onchocerca volvulus parasite. Understanding onchocerciasis. Onchocerciasis is a parasitic disease caused by the worm Onchocerca volvulus, transmitted to humans through the bites of infected black flies. The disease is characterized by severe itching, disfiguring skin conditions, and visual impairment, including permanent blindness. It primarily affects rural populations in sub-Saharan Africa and Yemen, with smaller endemic areas found in parts of Latin America. Niger's path to elimination. Niger's journey toward eliminating onchocerciasis involved a combination of vector control measures and mass drug administration, MDA. Between 1976 and 1989, under the WHO Onchocerciasis Control Program in West Africa, OCP, Niger conducted vector control by spraying insecticides, significantly reducing transmission levels. From 2008 to 2019, the country implemented MDA with ivermectin and albendazole, targeting areas affected by lymphatic filariasis, LF. Since ivermectin is effective against both diseases, this intervention also contributed to interrupting the transmission of the Onchocerca volvulus parasite. In 2014, Niger began preliminary assessments on the interruption of onchocerciasis transmission. Entomological and epidemiological surveys revealed that the combination of medicine and vector control had successfully eliminated transmission, evidenced by a reduction in prevalence from approximately 60% to 0.02%. Critical analysis. Factors contributing to Niger's success. Niger's success can be attributed to several key factors. 1. Strong government commitment. The Nigerian government's dedication to public health and its proactive approach in implementing control measures were crucial. 2. Effective partnerships. Collaboration with WHO, non-governmental organizations, and international partners provided technical support and resources. The partnership with the Reaching the Last Mile Fund, RLMF, co-led by the End Fund and the global health philanthropy of His Highness Sheikh Mohammed bin Zayed Al Nahyan, was instrumental in mobilizing resources and technical support. 3. Sustainable community engagement. Engaging local communities in treatment distribution and health education ensured high coverage and adherence to MDA programs. 4. Continuous monitoring and surveillance. Ongoing monitoring allowed for timely adjustments in strategies, ensuring the effectiveness of interventions. Africa-wide comparison. Niger's achievement is a significant milestone for Africa, where onchocerciasis remains a major public health challenge. While countries like Uganda have made notable progress, with some areas achieving elimination, the continent as a WHO continues to grapple with the disease. The WHO's verification of Niger's elimination status underscores the potential for other African nations to achieve similar success through sustained commitment, effective partnerships, and community engagement. Forward-looking approach. Building on Niger's success, it is imperative to enhance regional collaboration. Sharing best practices and resources among African countries can accelerate the elimination of onchocerciasis across the continent. Strengthen health systems. Investing in robust health infrastructure and workforce training is essential for sustaining elimination efforts and preventing disease resurgence. Secure sustainable funding. Long-term financial commitments are necessary to maintain MDA programs and surveillance activities. Develop new tools. Research into vaccines and alternative treatments can provide additional weapons in the fight against onchocerciasis. Latest developments. The WHO's verification of Niger's elimination of Onchocerciasis is a testament to the effectiveness of integrated control strategies. This achievement not only improves public health but also enhances economic development by reducing the burden of disease. It serves as a model for other nations, demonstrating that with coordinated efforts, the elimination of neglected tropical diseases is attainable. The importance of Niger's success for Africa and global health. Niger's success serves as an inspiration not just for other African nations, but for the global health community at large. Eliminating onchocerciasis is not just about eradicating a disease, it is about alleviating human suffering, restoring dignity, and empowering communities. In a region where neglected tropical diseases, NTDs, have historically been overlooked, Niger's achievement signals the possibility of overcoming the most intractable health challenges. Impact on Africa's development and economy. Onchocerciasis has been a major impediment to economic development in affected regions. Rural communities often rely on rivers for fishing, farming, and transportation, but the presence of the disease has forced many to abandon these areas, driving them away from their livelihoods. This not only harms individuals' health, but also hinders the broader economic potential of the affected regions. By eliminating onchocerciasis, Niger has freed its population from these economic shackles, potentially opening doors to greater agricultural productivity, improved education, and access to health services. With a healthier population, the country is positioned for increased economic growth, better quality of life, and enhanced regional collaboration. African Union's role in scaling up efforts. The African Union, AU, has a critical role to play in scaling up the lessons learned from Niger's success across the continent. The AU's regional health organizations, including the African Centers for Disease Control and Prevention, Africa CDC, should intensify efforts to facilitate cross-border coordination, especially in areas with shared river systems and populations susceptible to onchocerciasis. A regional approach could accelerate the elimination of the disease by addressing the shared challenges of disease transmission across national borders. The role of international organizations and partnerships. Niger's achievement would not have been possible without sustained support from international organizations such as the WHO, the Global Fund, and the Bill and Melinda Gates Foundation, among others. These organizations have been instrumental in providing financial resources, technical expertise, and advocacy for neglected tropical diseases. Niger's success is also a testament to the effectiveness of public-private partnerships, with pharmaceutical companies like Merck & Co. donating ivermectin, a critical tool in the fight against river blindness, expanding on the global push against NTDs. Niger's success also comes at a time when the world is seeing a renewed push to eliminate NTDs globally. As part of the United Nations Sustainable Development Goals, SDGs, the elimination of onchocerciasis and other NTDs is a key target for improving health outcomes, particularly for the most vulnerable populations. In this context, Niger's success offers a roadmap for other countries with high burdens of NTDs, especially those in sub-Saharan Africa, to follow. The power of community engagement and education. One of the most effective strategies in the fight against onchocerciasis in Niger was the active involvement of local communities in the distribution of treatment and health education. For any disease elimination program to succeed, it is essential to have community support and involvement. In Niger, local health workers and community leaders played a key role in educating the public about the importance of taking preventive medicine and understanding how the disease is transmitted. Community engagement has been critical not just in ensuring treatment coverage, but also in building trust between the health system and the population. Challenges in sustaining elimination efforts. Despite the monumental achievement, the sustainability of onchocerciasis elimination efforts remains a significant challenge. Niger, like other countries, must continue surveillance to detect any potential resurgence of the disease. The global community must remain committed to providing support to countries, not just during the elimination phase but also in the years that follow, to ensure that transmission remains under control. Moreover, while Niger has made significant strides, other NTDs like lymphatic filariasis, schistosomiasis, and trachoma continue to affect large segments of the population. Niger will need to continue addressing these diseases to ensure that the progress made in eliminating onchocerciasis does not become undone by the persistence of other tropical diseases. A broader perspective on global health equity. Niger's achievement is an important step toward global health equity. It demonstrates that diseases affecting the poorest populations can be eliminated with the right combination of political will, community engagement, international support, and scientific innovation. Success also highlights the importance of investing in public health programs for neglected diseases, which are often seen as less urgent compared to other global health priorities. As the world continues to confront the COVID-19 pandemic and other emerging health threats, Niger's success with Onchocerciasis offers a crucial lesson on the importance of investing in long-term health initiatives, especially for the most marginalized populations. Looking ahead, a call to action for Africa and beyond. The elimination of Onchocerciasis in Niger should serve as a clarion call for other African nations grappling with the disease. While there are still hurdles to overcome in the fight against NTDs, the example set by Niger shows that with a focused effort, diseases like river blindness can be defeated. It is crucial that the international community, African governments, and local communities continue to work together to build on Niger's success. By sharing knowledge, resources, and technical expertise, nations can accelerate their progress in eliminating NTDs and improving the quality of life for millions of people. The role of research and innovation. As we move forward, research and innovation will play a pivotal role in sustaining the success of Onchocerciasis elimination and in tackling other NTDs. New diagnostic tools, vaccines, and treatment regimens could provide additional layers of protection against these diseases, making it easier to detect and treat them earlier. Investing in research, especially into vaccines for Onchocerciasis and other NTDs, will be essential in ensuring that the progress made in Niger and other countries is not only sustained, but expanded to include even more diseases. A historic step toward a healthier Africa. Niger's success in eliminating Onchocerciasis marks a historic moment in the fight against neglected tropical diseases in Africa. As the first country in the region to interrupt the transmission of river blindness, Niger is setting an example for other nations to follow. Through effective government leadership, international collaboration, community engagement, and continued surveillance, Niger has shown that disease elimination is not only possible but achievable. As other African countries work toward similar successes, the global health community must continue to support these efforts and invest in sustainable solutions to ensure that the gains made today are not lost in the future. Building on Niger's success, the path forward for Africa. As Niger's remarkable achievement resonates across the continent, the next challenge will be to ensure that the lessons learned from this success are implemented in neighboring countries. The elimination of Onchocerciasis in Niger provides an invaluable opportunity to scale up efforts in other African nations where the disease still poses a threat. Niger's success story serves as both a motivator and a practical roadmap for countries with ongoing challenges in controlling and eliminating the disease. Regional collaboration for a Pan-African strategy. One of the key lessons from Niger's success is the importance of regional collaboration in tackling Onchocerciasis. Given the transnational nature of Onchocerciasis, with rivers serving as the primary breeding grounds for the black flies that transmit the parasite, countries that share river systems must work together to control disease. Regional cooperation, such as the West African Onchocerciasis Control Program, has been proven to be a model of success, and similar initiatives must be expanded and strengthened in other areas of the continent. The African Union, AU, and the World Health Organization, WHO, could play a pivotal role in coordinating these regional efforts, facilitating cross-border disease control measures, and ensuring that the experience gained in Niger can be applied to countries with similar challenges. Leveraging technology for disease surveillance and monitoring. Another important aspect of Niger's success has been its robust surveillance systems. Continuous monitoring and data collection allowed for timely adjustments in strategies and provided crucial evidence that the transmission of Onchocerciasis had been interrupted. For many African nations still grappling with Onchocerciasis, strengthening surveillance systems and integrating modern technologies such as geographic information systems, GIS, mobile health apps, and remote sensing could dramatically improve the monitoring and control of the disease. As digital health technologies continue to evolve, They hold great potential for improving the efficiency and effectiveness of public health responses. Using digital tools for disease tracking and real-time data sharing can lead to faster responses and more targeted interventions, which is critical in ensuring that onchocerciasis does not resurge in previously affected areas. A long-term commitment, addressing other NTDs in Africa. While onchocerciasis has been eliminated in Niger, the battle against other neglected tropical diseases, NTDs, is far from over. Diseases such as schistosomiasis, lymphatic filariasis, and trachoma still affect millions of people across sub-Saharan Africa, and Niger must continue its fight against these diseases. In addition to onchocerciasis, Niger previously demonstrated leadership in public health by eliminating guinea worm disease, dracunculiasis, in 2013. Now, as the country sets its sights on other NTDs, the focus must be on integrating efforts, ensuring that multiple diseases are tackled simultaneously. For example, the same MDA strategies that helped eliminate onchocerciasis can also be applied to combat other NTDs, such as lymphatic filariasis and soil-transmitted helminths. A holistic approach to disease elimination, one that addresses multiple NTDs together, will be essential for achieving long-term success in Niger and throughout Africa. Mobilizing resources for continued success. Sustaining the progress made in Niger will require continued financial and technical support from both domestic and international partners. The international community must continue to invest in NTD elimination, and governments must prioritize these diseases in their national health strategies. Merck & Co.'s long-standing partnership with WHO in the donation of ivermectin has been pivotal in eliminating onchocerciasis. Such public-private partnerships will need to be expanded to address other NTDs. Furthermore, the mobilization of local resources and ensuring that affected communities remain engaged will be crucial in sustaining elimination efforts. The role of education and advocacy. Public education and advocacy will remain essential as Niger continues its NTD elimination efforts. Raising awareness about the benefits of NTD elimination, such as improved health, economic productivity, and social inclusion, can galvanize support at both the community and national levels. In Niger, local health workers and community leaders have already played a critical role in disseminating information about the importance of mass drug administration, MDA, and controlling disease transmission. This model of community engagement should be expanded and applied to future NTD elimination efforts, ensuring that communities understand the significance of their involvement and the potential benefits to their livelihoods. Global recognition and the future of neglected tropical disease elimination. Niger's elimination of onchocerciasis is a global health achievement that deserves recognition, but it must also serve as a reminder of the work that remains to be done. While 5 countries have now been verified by WHO for eliminating onchocerciasis, more than 100 million people in 31 African countries are still at risk of infection. Global health organizations, national governments, and the private sector must continue to work together to ensure that onchocerciasis is eliminated across the continent. Through sustained efforts, strategic partnerships, and innovative solutions, it is possible to imagine a future in which neglected tropical diseases like onchocerciasis are a thing of the past, and health equity becomes a reality for all Africans. Looking ahead, achieving the vision of a disease-free Africa. As we look to the future, Niger's success in eliminating river blindness provides hope not only for Africa, but for the world. If Niger can succeed, then so can other African nations facing similar health challenges. The fight against neglected tropical diseases is far from over, but Niger's experience demonstrates that with commitment, collaboration, and innovation, the elimination of these diseases is possible. The challenge now is to ensure that the momentum generated by Niger's achievement is not lost. As the world focuses on global health challenges, let Niger's story be a beacon of hope, showing that through concerted efforts, even the most neglected diseases can be eradicated, and a healthier, more prosperous future for Africa can be realized. Expanding the vision, building on the momentum of Niger's success. Niger's success in eliminating onchocerciasis is not just a local achievement, it has implications that reach far beyond its borders. As the first African country to achieve this milestone, Niger has set the stage for a broader regional and global initiative to tackle neglected tropical diseases, NTDs. The ripple effect of Niger's success can inspire policy changes and increase funding for NTD programs across Africa and other parts of the world. Regional leadership and collaboration. For Africa to reach the ambitious goal of eliminating Onchocerciasis in all affected areas, it is essential for countries to collaborate and share resources and knowledge. Niger's elimination of the disease shows that when regional leaders come together, coordinated efforts can lead to success. A multi-country approach, focused on shared river basins and ecosystems, is critical for controlling the spread of diseases like Onchocerciasis. The establishment of regional forums, where countries can exchange lessons learned and discuss strategies for tackling NTDs, will be essential. Niger's leadership in this space can help other countries that are still struggling with onchocerciasis or similar diseases. The economic and technical cooperation fostered through such regional dialogues can amplify the impact of control efforts and ensure that interventions are tailored to each country's unique challenges. Investment in research and development. The next step for Africa and the global health community is to invest in research and development to expand the toolbox for eliminating onchocerciasis and other NTDs. While ivermectin has been a game changer, it is not a complete solution for all affected populations. Continued research into new treatments, diagnostics, and even vaccines will play a crucial role in ensuring that the gains made in Niger are sustainable and can be replicated in other countries. There is an urgent need for new tools to accelerate elimination efforts, especially for areas where vector control and mass drug administration are less effective. Research into developing a vaccine for onchocerciasis would be a game changer in the fight against the disease. Such breakthroughs could make it easier to control transmission and potentially eliminate the disease entirely. By investing in research, African countries can become active participants in the development of solutions that meet the continent's unique public health needs. The role of political will in sustaining progress. One of the most critical elements in Niger's success has been the strong political will exhibited by the Nigerian government. The government's commitment to public health, through continuous funding, policy support, and coordination with international partners, has been crucial. For Niger's success to be sustainable and replicated in other countries, political leadership across the continent must prioritize public health and NTD elimination. African governments must take ownership of their health programs, allocating the necessary resources, and providing the political backing required for long-term success. Political will is also essential for ensuring that NTDs remain high on the health agenda, especially as the continent faces new challenges, including the rise of emerging diseases like Ebola and COVID-19. Maintaining focus on NTDs, which have long been overlooked, will require leaders to champion the cause and align their health strategies with international targets like the United Nations Sustainable Development Goals, SDGs. Niger's impact on the global fight against NTDs. Niger's success resonates globally, serving as a powerful message that eliminating onchocerciasis and other neglected diseases is not only achievable, but also sustainable. The fight against NTDs has historically received limited attention and funding, but Niger's achievement is shifting this narrative. International organizations, including the WHO, the Bill and Melinda Gates Foundation, and other global health players, must continue to invest in these diseases, recognizing that they are not merely health challenges, but significant barriers to poverty alleviation, economic development, and education. Niger's achievement is particularly significant in the context of global health disparities. It demonstrates that even the most underserved populations in sub-Saharan Africa can benefit from international collaboration and targeted public health interventions. As more countries across the continent and the world follow in Niger's footsteps, the global health community can focus on scaling up these successes and ultimately ending the cycle of NTDs. The need for education and advocacy in the fight against NTDs. A crucial component of Niger's success has been the active involvement of communities in the fight against onchocerciasis. In many African nations where NTDs continue to be a significant public health issue, there is often a lack of awareness about how these diseases are transmitted and how they can be prevented. Education campaigns in affected communities have been critical for building trust and ensuring the success of mass drug administration programs. Niger's example highlights the importance of public education and community involvement in both the prevention and elimination of NTDs. As other countries look to replicate Niger's success, they must prioritize education and advocacy campaigns that inform populations about the risks of NTDs and the importance of participating in prevention and treatment programs. Local health workers, community leaders, and religious groups should be empowered to lead these efforts, creating grassroots support that can help ensure the long-term success of elimination initiatives. Integrating NTD elimination into broader health and development strategies. For NTD elimination to be truly sustainable, it must be integrated into broader health and development strategies. Countries should aim to create a health system that can respond to a range of public health threats, while also addressing the social determinants of health such as poverty, education, sanitation, and access to clean water. Incorporating NTD elimination into broader health programs will also help to address the interlinkages between diseases. For example, areas that are affected by Onchocerciasis may also suffer from other diseases like malaria and tuberculosis. Integrated health interventions that target multiple diseases simultaneously can make better use of limited resources and have a more significant impact on health outcomes. The success of NTD programs in Niger shows that public health interventions, when well coordinated and sufficiently funded, can lead to significant improvements in both health outcomes and economic well-being. By positioning NTD elimination as part of a larger public health and development strategy, countries can achieve long-term, sustainable improvements in health and prosperity. The role of global partnerships in scaling NTD elimination. Global partnerships have been fundamental to Niger's success, and the continuation of these collaborations will be essential for scaling NTD elimination efforts across Africa. International organizations like the WHO, World Bank, and the Global Fund have played key roles in mobilizing resources, providing technical expertise, and coordinating efforts between governments, non-governmental organizations, NGOs, and the private sector. Niger's achievement in eliminating onchocerciasis could not have been achieved without the strong collaboration between the government, local communities, international partners, and private entities such as Merck & Co., which provided the essential drug ivermectin. Success is a testament to the effectiveness of these multi-sector partnerships in addressing complex global health challenges. To build on Niger's success, continued support from international partners is needed. These partners must provide financial resources, technical support, and advocacy for NTD elimination, especially in countries that may not have the domestic funding capacity to address these diseases on their own. Additionally, partnerships between African countries themselves, through platforms such as the African Union and regional health organizations, will be crucial for sharing knowledge, best practices, and coordinating cross-border strategies. The importance of community-driven approaches in future NTD elimination. One of the standout factors in Niger's successful elimination of onchocerciasis has been the active involvement of local communities in the delivery of health interventions. The success of mass drug administration, MDA campaigns, and vector control strategies heavily relied on the participation of local populations. WHO took part in both the distribution of treatment and the monitoring of the disease's prevalence. For any NTD elimination program to succeed, it must be rooted in community engagement. Local populations need to be well informed about the diseases they are fighting and be involved in the decision-making processes around health interventions. In Niger, local health workers and community leaders were critical in building trust with the population, ensuring the success of the MDA campaigns, and providing crucial feedback on the impact of interventions. As African countries embark on their own NTD elimination journeys, they should invest in community-driven approaches, ensuring that local health workers and community leaders are at the forefront of disease control efforts. This will not only ensure high participation rates in treatment programs, but also build a sense of ownership within the communities, which is key to maintaining progress in the long term. Addressing the challenges of urbanization and migration in NTD elimination. While rural populations have been the most affected by onchocerciasis and other NTDs, urbanization and migration present new challenges for disease elimination programs. With increasing urbanization in Africa, more people are moving from rural areas where NTDs are endemic to urban centers, where access to healthcare is generally better. This shift in population movement could potentially lead to the spread of NTDs in urban areas, where the infrastructure and systems for managing such diseases may not be as robust as in rural regions. Additionally, migration patterns, particularly across national borders, may complicate efforts to eradicate diseases like Onchocerciasis, which requires coordination between multiple countries. To address these challenges, NTD elimination programs will need to adapt to urban realities. Urban-based interventions, including awareness campaigns, mobile health clinics, and the use of technology for disease monitoring, will become increasingly important. Migrant populations must also be targeted in health outreach programs to prevent the transmission of NTDs from rural to urban settings. Strengthening surveillance systems and early warning systems. Niger's achievement was made possible by a robust surveillance system that allowed for early detection and rapid responses to potential disease outbreaks. As NTD elimination efforts expand across Africa, strengthening surveillance systems will be critical in preventing the resurgence of diseases like Onchocerciasis. Investing in early warning systems that can quickly identify changes in disease prevalence or the emergence of new outbreaks will be vital. These systems should use data from multiple sources, including community reports, health facilities, and mobile technologies to provide real-time information on disease trends. Early detection allows for timely interventions that can prevent the spread of the disease and ensure that NTD elimination remains on track. Moreover, these surveillance systems should be integrated into broader health information networks that allow for the efficient sharing of data between countries. Cross-border surveillance and cooperation will be crucial in controlling diseases that span multiple nations, such as Onchocerciasis. Expanding financial commitments for NTD control. The financial commitments required to sustain and expand NTD elimination programs are significant. While global funding has played a key role in Niger's success, domestic funding from governments will be equally essential for the long-term sustainability of these efforts. Governments must prioritize NTD elimination in their national health budgets and create funding mechanisms that ensure resources are available for both current interventions and future challenges. Donor funding will continue to be essential, but governments must take ownership of NTD elimination programs to ensure that they are sustainable and integrated into broader health systems. The private sector, including pharmaceutical companies and international foundations, will also continue to play an important role in providing funding, medicines, and technical support. Partnerships between governments, international organizations, and the private sector will be critical for scaling up NTD elimination efforts in Africa. Advocacy and public awareness, changing the narrative on NTDs. One of the biggest challenges in addressing NTDs is the stigma and lack of awareness surrounding these diseases. For years, Onchocerciasis and other NTDs have been considered diseases of poverty, often ignored in global health discussions. However, Niger's success demonstrates that these diseases can be eliminated with the right interventions, and it is critical to change the narrative around them. Public awareness campaigns are needed to highlight the significance of NTDs, not just as a health issue, but as a key factor in development. NTDs contribute to the cycle of poverty by preventing people from working, attending school, or participating fully in society. Raising awareness about the importance of eliminating these diseases can build public support for NTD control programs and encourage both governments and international organizations to continue investing in them. A unified effort for a healthier Africa. Niger's success in eliminating Onchocerciasis is a landmark achievement that shows what is possible when governments, communities, and global partners work together. As the first African country to achieve this milestone, Niger has set a powerful example for the rest of the continent. But the fight against NTDs is far from over. To build on Niger's success, African nations must invest in strengthening health systems, fostering regional cooperation, engaging communities, and maintaining strong political will. By focusing on research, surveillance, public awareness, and financial sustainability, African countries can make significant progress in eliminating Onchocerciasis and other NTDs. The path forward requires continued commitment, collaboration, and innovation. The elimination of Onchocerciasis in Niger is proof that a healthier Africa is within reach, and the lessons learned from this success can guide the continent toward a future free from neglected tropical diseases. The role of regional bodies in scaling NTD elimination. regional organizations such as the African Union, AU, and the West African Health Organization, WHO, have a vital role to play in scaling up NTD elimination efforts. These bodies are uniquely positioned to foster collaboration between neighboring countries, coordinate cross-border initiatives, and ensure that countries facing similar challenges can share resources and expertise. The African Union's efforts to integrate health goals into its broader development agenda have already made significant strides in promoting NTD elimination. By prioritizing health as part of the African Union's Agenda 2063, there is a clear pathway for integrating NTD control and elimination within the framework of overall socio-economic development on the continent. This approach will ensure that NTD elimination is not seen as an isolated health initiative, but as an integral part of Africa's development and prosperity. Moreover, the African Union's efforts to strengthen regional cooperation on health issues could enhance information sharing and collaboration in disease control efforts. This kind of partnership will be essential in tackling the spread of NTDs, particularly in border regions where the movement of people can fuel the transmission of diseases like Onchocerciasis. Leveraging technology to enhance health systems. As Africa continues to invest in the elimination of NTDs, it must also embrace technological advancements that can improve both disease monitoring and intervention. Digital health technologies, such as mobile health platforms, electronic medical records, and geospatial data systems, can significantly improve the efficiency and effectiveness of NTD programs. Mobile health applications that allow individuals to track their health status and receive timely information about treatment schedules can improve community engagement and compliance. Geographic information systems, GIS, and remote sensing technologies can help health officials track the prevalence of NTDs, map out at-risk areas, and allocate resources more effectively. In Niger, for example, the use of data-driven approaches helped ensure that disease transmission data was collected and acted upon promptly, making it easier to evaluate progress and modify strategies as needed. Furthermore, new diagnostic tools are needed to identify and monitor NTDs more effectively, allowing health systems to respond rapidly to changes in disease patterns. As research and development continue in this area, technology will play an even greater role in eliminating Onchocerciasis and other NTDs across Africa. The power of public-private partnerships. The role of private sector partnerships cannot be overstated in the fight against NTDs. Companies like Merck, which has been a leader in the donation of ivermectin for the treatment of Onchocerciasis, have played a pivotal role in Niger's success. These partnerships have enabled governments and international organizations to implement large-scale, cost-effective solutions to combat the disease. As NTD elimination efforts expand across Africa, it will be critical for governments and organizations to cultivate stronger relationships with the private sector. Pharmaceutical companies, tech firms, and other private organizations can provide resources, expertise, and innovations that help amplify NTD elimination strategies. However, these partnerships must be transparent, accountable, and focused on long-term sustainability, ensuring that the benefits of collaboration reach the communities that need them the most. Building resilience to future health threats. While Niger's success in eliminating onchocerciasis is a significant achievement, it also offers valuable lessons for strengthening resilience to other health threats. By prioritizing NTD elimination and improving health infrastructure, countries can build stronger, more responsive healthcare systems that are better equipped to handle emerging diseases. This resilience is essential not only for combating current health threats like malaria and tuberculosis, but also for preparing for future outbreaks of infectious diseases, such as the next pandemic. Building health system resilience involves investing in the health workforce, improving data collection and surveillance, and expanding access to essential medicines and vaccines. As the world continues to confront public health challenges, the lessons from Niger's success can inform strategies to prevent the spread of infectious diseases, mitigate their impacts, and protect vulnerable populations. Long-term sustainability and global health equity. The goal of NTD elimination is not just the eradication of specific diseases, but the creation of equitable and sustainable health systems. Niger's achievement in eliminating onchocerciasis demonstrates that, with the right investments and strategies, it is possible to achieve long-term disease elimination, even in the poorest and most resource-constrained regions. Sustainability, however, requires more than just one-off interventions or short-term campaigns. It requires long-term political and financial commitment from governments, global organizations, and local communities. Governments must allocate sufficient funding to sustain NTD programs, ensure that medicines are distributed regularly, and continue surveillance to prevent any resurgence of the disease. The global community, including wealthy nations and international donors, must also maintain support for the long-term elimination of NTDs. Funding must be sustainable and flexible, allowing for adaptive responses to changes in disease dynamics. NTD programs must be integrated into broader health and development agendas, with a focus on improving health systems, education, infrastructure, and sanitation. Empowering communities for lasting change. Communities must be at the heart of NTD elimination efforts. Niger's success was made possible by the active involvement of local populations. WHO participated in mass drug administration campaigns, helped monitor disease transmission, and played a crucial role in spreading health education. Empowering communities to take ownership of their health outcomes ensures that NTD programs are effective and sustainable in the long term. In addition to health education, addressing the underlying social determinants of health, such as poverty, access to clean water, and nutrition, will further enhance the effectiveness of NTD elimination efforts. Addressing these issues can reduce the burden of NTDs and ensure that communities have the tools and resources they need to maintain a healthy, disease-free future. Expanding access to treatment and care. Another important aspect of NTD elimination is ensuring that populations have access to treatment and care. In many parts of Africa, access to healthcare services remains limited, especially in rural areas. Expanding access to treatment through mobile clinics, telemedicine, and outreach programs is essential for reaching people in remote or underserved areas. In Niger, the successful distribution of ivermectin was facilitated by a network of community health workers and volunteers. WHO helped ensure that treatment reached even the most isolated populations. This model of community-based healthcare delivery should be expanded across Africa, allowing for the rapid deployment of essential medicines and health services. Global health partnerships for future success. Looking ahead, Niger's success provides a blueprint for continued progress in the global fight against neglected tropical diseases. By fostering collaboration between governments, international organizations, NGOs, and the private sector, Africa can move closer to achieving the elimination of Onchocerciasis and other NTDs on the continent. Niger's example shows that when the right strategies are in place, supported by strong leadership, community engagement, and international collaboration, even the most neglected diseases can be defeated. This success is not only a victory for Niger, but also a beacon of hope for other countries still struggling with NTDs. The global health community must work together to ensure that the momentum created by Niger's success continues to drive progress toward a healthier, disease-free Africa. Lessons for global health policy and equity. Niger's success in eliminating Onchocerciasis offers critical lessons for global health policy. It underscores the importance of focusing on neglected diseases that disproportionately affect the poorest and most marginalized populations. Too often, diseases like Onchocerciasis have been sidelined in the broader global health agenda due to the perceived complexity and cost of eliminating them. Niger's achievement proves that, with sustained effort, these diseases can be controlled and eradicated. For global health policymakers, Niger's progress highlights the necessity of prioritizing diseases that hold back socioeconomic development. The elimination of onchocerciasis not only improves health, but also has profound economic implications as it reduces disability, increases productivity, and opens up access to vital resources, like river-based agriculture and fishing. Therefore, prioritizing the elimination of neglected tropical diseases, NTDs, aligns with broader development goals, such as poverty reduction, education, and inclusive economic growth. Globally, the success of Niger serves as a wake-up call to invest more in NTDs, not only from a health perspective but also as a means of achieving the United Nations Sustainable Development Goals, SDGs. Ending poverty, promoting good health and well-being, and fostering economic growth are all inextricably linked to tackling diseases like onchocerciasis. By eliminating these diseases, countries can achieve significant strides in poverty alleviation and sustainable development. The role of domestic health systems in NTD elimination. The fight against NTDs cannot rely solely on external partners and interventions. Niger's success shows that the strength of domestic health systems is paramount. The government of Niger not only took ownership of the elimination campaign, but also demonstrated the ability to effectively coordinate between ministries, agencies, and external partners. This kind of leadership and coordination is key to ensuring that NTD elimination efforts are sustainable. Building and strengthening national health systems will be crucial for other African countries that are still working toward eliminating Onchocerciasis or dealing with other NTDs. These health systems must be adequately resourced, equipped with trained personnel, and supported by strong infrastructure to deliver essential services such as mass drug administration, MDA, surveillance, and emergency responses. Long-term sustainability also depends on domestic funding commitments. Countries must ensure that NTD programs are integrated into national health budgets and treated as priority areas for funding. Domestic financial investment will help ensure that these programs continue to function effectively, even when external funding decreases or fluctuates. Health education and public awareness campaigns. One of the key pillars of Niger's success in eliminating onchocerciasis was the extensive health education and public awareness campaigns. These efforts helped mobilize communities, encourage participation in MDA programs, and ensure that people understood how onchocerciasis was transmitted and how it could be prevented. In many African countries, public health campaigns on NTDs remain limited, often due to a lack of awareness or funding. The success of Niger provides an important model for public health education programs that aim to reduce the stigma associated with NTDs, improve health literacy, and promote positive health behaviors. By ensuring that populations are not only treated but also educated about the importance of disease prevention, future NTD elimination programs will be more effective. Furthermore, such public awareness campaigns can help reduce misconceptions about treatment and foster trust in government-led health initiatives. Health workers and community leaders should be the focal points for disseminating information, as they are trusted figures within local communities. Fostering innovation in NTD elimination strategies. As the world looks to eliminate onchocerciasis across Africa, innovation will play an essential role in overcoming the challenges that remain. Niger's success demonstrates that vector control, combined with mass drug administration, can be highly effective. However, continued innovation in drug delivery mechanisms, diagnostic tools, and surveillance technologies will be necessary to enhance the efficiency of future elimination efforts. For instance, the development of new delivery methods, such as prepackaged medicines or injectable drugs, could make it easier to distribute treatments to remote areas, improving the reach of interventions. Similarly, advances in diagnostic tools can enable health workers to identify cases more quickly and monitor progress more accurately. Genetic research into the Onchocerca volvulus parasite itself could also uncover new ways to combat the disease, potentially leading to more targeted and effective treatments. Governments and international partners must invest in health innovation and make sure that new technologies and approaches are tested and scaled up quickly. By fostering innovation, the world can ensure that the next generation of public health strategies is even more effective at eliminating NTDs. Cross-border cooperation in disease control. Since onchocerciasis is primarily transmitted through the bite of black flies that breed in riverine areas, effective elimination requires a cross-border approach. Niger shares its borders with countries that are also affected by onchocerciasis, including Mali, Nigeria, and Burkina Faso. To ensure that the disease is fully eradicated, these countries must work together to control the disease across shared ecosystems. The implementation of a regional framework for NTD elimination would help address the challenges posed by cross-border disease transmission. This framework should focus on ensuring that treatment and vector control efforts are aligned across borders, and that neighboring countries share surveillance data, resources, and best practices. Countries with shared river systems, such as those in West Africa, could benefit from collaborative disease monitoring and management systems. Regional health organizations like the West African Health Organization, WAHO, can play a crucial role in facilitating this cooperation, ensuring that national health systems are synchronized and can effectively respond to the spread of diseases like onchocerciasis. The role of youth and education in public health. One of the most promising areas for future NTD elimination efforts is the involvement of youth and students in public health campaigns. By engaging young people in the fight against Onchocerciasis and other NTDs, countries can build a generation of health advocates. WHO are not only informed but also motivated to lead the charge in improving their communities' health outcomes. Education systems can incorporate NTD awareness into their curricula, ensuring that the next generation understands the importance of preventing and treating these diseases. Youth clubs, student organizations, and youth-led NGOs can also become effective platforms for organizing awareness campaigns, volunteering for health initiatives, and spreading vital information about NTDs. Moreover, universities and research institutions can play a role by training the next generation of public health professionals, researchers, and community health workers. WHO will carry on the work of NTD elimination in the future. Empowering youth to take an active role in health education and disease control will ensure that the momentum for NTD elimination is sustained for years to come. Moving toward a NTD-free Africa, Niger's success in eliminating Onchocerciasis is a monumental achievement that sets the stage for a future where Africa is free of neglected tropical diseases. This success is a result of concerted efforts from governments, international organizations, communities, and private partners, each playing a vital role in the achievement. By scaling up these efforts, strengthening health systems, fostering regional cooperation, and focusing on long-term sustainability, other African nations can follow in Niger's footsteps. Through continued innovation, financial investment, and community-driven solutions, it is possible to eliminate Onchocerciasis and other NTDs across the continent. The global health community must commit to this fight, recognizing that the elimination of NTDs is not just a health issue, but a broader socio-economic imperative. A healthier, more prosperous Africa is within reach, and Niger has shown that this goal is attainable if the right strategies are put in place. Leveraging the international community's support for Africa's health goals. Niger's victory in eliminating Onchocerciasis is not only a national success but a clear demonstration that the international community's support can significantly impact Africa's public health outcomes. Donor funding, global health organizations, and multinational corporations have a role to play in ensuring that NTD elimination efforts across the continent are sustained. The global health community must continue to provide the necessary resources, expertise, and advocacy to enable African nations to reach the ambitious goal of eradicating Onchocerciasis and other NTDs. Pharmaceutical companies such as Merck have already proven the power of private sector involvement by providing essential medicines at no cost. This kind of public-private partnership is crucial for the success of NTD programs. As more African countries aim for NTD elimination, the private sector's role in providing medicines, research support, and funding should be further emphasized. Additionally, large-scale pharmaceutical companies can partner with African governments to expand the availability of treatment, especially in hard-to-reach areas. The Global Fund, WHO, and other international partners should continue to work with African governments to establish long-term strategies for NTD control and funding mechanisms. Ensuring that health financing is predictable and sustainable will help Africa continue its path to eliminating these diseases without the constant uncertainty about resources. Tracking progress and ensuring accountability. While Niger's success is a beacon of hope, the task of eliminating Onchocerciasis in other parts of Africa requires systematic monitoring, transparent reporting, and accountability. Countries must track their progress with measurable indicators and share these results within international frameworks to ensure that interventions are working as intended. Niger's elimination of Onchocerciasis was made possible due to a robust surveillance system that not only tracked the disease but also adapted and adjusted the strategies when necessary. This approach should be scaled up to other countries to provide real-time data that helps guide NTD programs. International bodies like the WHO and the African Centers for Disease Control and Prevention, Africa CDC, can serve as critical partners in ensuring that NTD programs are being implemented effectively. Regular assessments, site visits, and program audits will help governments and partners adjust their strategies as needed and ensure that no community is left behind in the battle against NTDs, supporting Africa's health workforce. One of the most underappreciated components of successful NTD elimination is the capacity of the local health workforce. Niger's success was bolstered by a well-trained cadre of healthcare workers. WHO could carry out mass drug administration (MDA) programs, conducting surveillance and educating communities. To scale these efforts, it is vital to invest in the training of more health professionals, particularly in rural and underserved areas. The healthcare workforce must be equipped with knowledge, skills, and tools to combat NTDs effectively, and they must have access to ongoing professional development to stay updated on best practices. Governments and international organizations should focus on strengthening health systems by increasing investment in the health workforce. This includes building the capacity of healthcare workers in epidemiology, disease management, and community engagement. Local health workers, especially those from the communities they serve, are the backbone of NTD control programs and should be supported through regular training, fair compensation, and career development opportunities. The role of national governments in long-term planning. For any successful NTD elimination program, strong leadership from national governments is key. Niger's achievement in eliminating Onchocerciasis reflects the country's commitment to improving public health and its recognition of the importance of NTD elimination for economic and social development. Other African nations must follow Niger's example by ensuring that NTD elimination is a priority within their national health plans. This includes setting clear targets, mobilizing resources, and committing to long-term strategies that go beyond the initial successes of disease elimination campaigns. Governments must also establish policies that integrate NTD programs into broader public health strategies, such as maternal and child health, water and sanitation, and nutrition. Addressing the social determinants of health, such as poverty and lack of access to clean water, will enhance the effectiveness of NTD interventions and help break the cycle of disease. Broadening the scope, tackling other neglected tropical diseases. While Onchocerciasis is a major victory, Niger's achievement should also serve as a reminder that many other neglected tropical diseases still affect millions of people in Africa. Diseases like schistosomiasis, lymphatic filariasis, and trachoma continue to have devastating effects on public health and socioeconomic development in affected countries. Eliminating multiple NTDs at the same time is not only more efficient but also more effective. It reduces the burden on health systems, lowers the cost of treatment, and maximizes the use of available resources. This approach, known as integrated NTD management, should become the standard for NTD elimination programs across Africa. For example, the same mass drug administration programs that successfully eliminated Onchocerciasis in Niger can also be used to treat other NTDs like lymphatic filariasis, making the approach both cost-effective and scalable. Countries should focus on an integrated approach to NTDs that simultaneously tackles multiple diseases, maximizes impact, and saves resources. Innovative financing for NTD elimination. To make NTD elimination a sustainable reality, innovative financing mechanisms are necessary. Traditional sources of funding, including donor aid and government budgets, may not be enough to meet the growing demand for NTD control programs. Innovative financing models such as impact investing, social impact bonds, and private-public partnerships can attract new sources of funding. By attracting investment from private entities, impact investors, and philanthropists, African countries can generate the financial resources required to scale up their NTD elimination efforts. A greater emphasis should also be placed on financing from domestic sources. Governments must be encouraged to allocate more funds to health and NTD programs, recognizing that eliminating these diseases will have significant economic and social benefits in the long term. Strengthening the global health architecture. Niger's success is not just a triumph for Africa, but also a win for the global health architecture. It is a testament to the effectiveness of coordinated global health efforts and the importance of multilateral institutions like the WHO and the Global Fund. The world has witnessed that diseases like Onchocerciasis can be eliminated with the right mix of political will, community involvement, innovative financing, and sustained international support. As we move forward, the global health system must continue to evolve to address emerging and ongoing challenges. It must be flexible enough to respond quickly to new threats, whether they are zoonotic diseases like Ebola or other NTDs that still require focused attention. The international community must be prepared to expand its commitment to NTDs, continuing to support countries in their efforts to eliminate these diseases and to strengthen the global health infrastructure to prevent the spread of future health crises. By building on Niger's success, the global health community can ensure that we are better equipped to handle future health challenges and work toward a world where no disease is left behind. Towards a future free from NTDs, Niger's success in eliminating onchocerciasis is a historic achievement that shows what is possible when governments, international organizations, and communities work together towards a common goal. This achievement, however, is just one piece of the puzzle. The broader challenge of eliminating all NTDs across Africa and the world will require continued effort, innovation, and cooperation. As we reflect on Niger's success, we are reminded of the power of resilience, the importance of partnerships, and the impact of long-term commitment. If we continue to build on this momentum, scale up our efforts, and invest in both immediate interventions and long-term solutions, we can look forward to a future where NTDs are no longer a barrier to health, prosperity, and development in Africa and beyond. Ensuring equity in NTD elimination, addressing health disparities. Niger's success in eliminating onchocerciasis highlights the importance of ensuring equity in public health efforts. NTDs are diseases of poverty, disproportionately affecting the most vulnerable populations, including rural communities, marginalized groups, and those with limited access to healthcare. For NTD elimination efforts to be truly successful, they must be designed with equity in mind, ensuring that the benefits of disease control reach everyone, particularly the most disadvantaged. The global community must ensure that NTD programs are not only implemented in areas where the disease is most prevalent but also reach communities that are at risk, including those in remote and underserved areas. This means addressing barriers to healthcare access such as geographic isolation, poverty, lack of education, and inadequate health infrastructure. By focusing on equity, countries can ensure that no one is left behind in the fight against NTDs. Furthermore, it's essential to integrate the voices of affected communities into the design and implementation of NTD programs. Community involvement ensures that interventions are culturally appropriate, acceptable, and aligned with local needs and preferences. As Niger demonstrated, when communities are engaged and empowered, public health programs are more likely to succeed. The need for political leadership and commitment. One of the key takeaways from Niger's success is the importance of strong political leadership in the fight against NTDs. Political commitment to public health not only helps secure funding for programs, but also fosters an environment where health systems can thrive. The political will to eliminate diseases like onchocerciasis must be sustained over the long term, even after the initial gains have been made. In many African countries, political leadership is the key to ensuring that NTD programs receive the attention and resources they deserve. Governments must not only set the policy framework for NTD control, but also advocate for the necessary investments in infrastructure, health systems, and human resources. They must prioritize NTDs alongside other public health priorities, such as infectious diseases, maternal and child health, and non-communicable diseases. For long-term success, political leaders should also advocate for the involvement of all sectors in public health, including education, agriculture, and finance. These cross-sectoral collaborations are vital to addressing the complex social determinants of health that contribute to the spread of NTDs, such as poverty, poor sanitation, and lack of clean water. The role of education and research in accelerating NTD elimination. In addition to political will, education and research will play a critical role in accelerating NTD elimination across Africa. While Niger's success in eliminating onchocerciasis is an important step, future progress will depend on a continual commitment to research, innovation, and education. Research into new drugs, vaccines, diagnostic tools, and vector control methods will be essential in speeding up the elimination of NTDs. While ivermectin has been effective in treating onchocerciasis, there is still a need for additional tools to tackle other NTDs and to complement existing interventions. Increased investment in NTD research will not only improve treatment options, but will also provide a more comprehensive understanding of the diseases, their transmission patterns, and the most effective ways to control them. Educational efforts, both within Africa and globally, are also key to achieving NTD elimination. Educating healthcare workers, policymakers, and the public about the importance of NTD control will help build greater awareness and support for programs. It will also empower communities to take ownership of their health and participate actively in disease prevention and treatment initiatives. Moreover, education is a fundamental part of breaking the stigma surrounding NTDs. Diseases like Onchocerciasis have long been associated with social exclusion and discrimination, and overcoming these barriers will require widespread public education and awareness campaigns. These efforts can help to shift perceptions, foster solidarity, and ensure that NTD programs have the broad-based support they need to succeed. Expanding international collaboration and solidarity. Niger's achievement in eliminating Onchocerciasis underscores the power of international collaboration. The success was made possible by the coordinated efforts of multiple stakeholders, including the WHO, the Global Fund, pharmaceutical companies, non-governmental organizations, and affected communities. This spirit of collaboration must continue to grow as countries strive to eliminate other NTDs and improve public health across the continent. In addition to regional cooperation, strengthening global partnerships will be essential in the fight against NTDs. As Niger's experience shows, no single nation can tackle these diseases alone. The resources, expertise, and political support required to eliminate NTDs must be mobilized at a global level, with rich countries supporting their poorer counterparts in achieving disease control and eradication. International partnerships can also help address the financial challenges of NTD elimination. Innovative financing mechanisms, such as health bonds, impact investment funds, and multi-donor trust funds, can help provide the resources needed to scale up programs across Africa. At the same time, international organizations must continue to advocate for increased funding for NTDs in both donor and recipient countries. Fostering resilience in health systems to prevent future health crises. Niger's success in eliminating onchocerciasis provides an important lesson on building resilience in health systems to prevent future health crises. As the world continues to face new health threats, such as pandemics and antimicrobial resistance, strengthening health systems will be essential for managing both existing and emerging health challenges. Resilient health systems are flexible, responsive, and capable of delivering a wide range of services under changing circumstances. To build such systems, African countries must prioritize investments in healthcare infrastructure, health worker training, and the availability of essential medicines and vaccines. Strengthening primary healthcare services, including disease prevention and health promotion, will ensure that health systems can not only respond to outbreaks, but also deliver essential health services to populations in need. Additionally, health systems should be prepared to adapt to new challenges. This includes the ability to manage new infectious diseases, as well as the increasing burden of non-communicable diseases like diabetes, hypertension, and cancer. A strong, integrated health system is essential for creating an environment where NTD elimination is not just a one-time achievement, but a sustainable outcome. The path ahead for Africa and the world. Niger's success in eliminating onchocerciasis represents a beacon of hope for Africa and the world. It shows that with the right mix of political will, international collaboration, and community engagement, even the most neglected diseases can be defeated. Niger's achievement is a clear call to action for other African countries to invest in NTD control and to build resilient health systems that can tackle both current and future public health challenges. By continuing to invest in research, innovation, and education, scaling up partnerships, and ensuring that NTD elimination is integrated into broader development strategies, Africa can make great strides toward a healthier future. The lessons learned from Niger's success offer a roadmap for other nations to follow, providing hope that a disease-free Africa is possible. As the global health community continues to build on this momentum, the focus must remain on ensuring equity, accessibility, and sustainability in the fight against NTDs. Only then can we create a future where health, dignity, and prosperity are within reach for all, regardless of where they live or their socioeconomic status. Mobilizing the next generation of health advocates. As we look to the future of NTD elimination, it is essential to engage and empower the next generation of health professionals, advocates, and leaders. Niger's success is not just a product of the current generation's efforts, but a testament to the long-term vision of public health leadership. To ensure that the gains made in eliminating onchocerciasis are not only sustained but expanded to other NTDs, young people must be given the tools and knowledge to take on the challenges of tomorrow. Educational institutions across Africa should prioritize the training of future public health leaders, focusing on NTDs, epidemiology, and global health governance. Encouraging young Africans to pursue careers in public health will provide a new cadre of professionals. WHO are deeply committed to addressing the continent's health challenges. Moreover, it will help build the capacity of African countries to address health crises and disease elimination autonomously, without relying on external actors. Youth engagement can also extend to public advocacy and awareness campaigns. Young people are often the most influential agents of change within their communities, and by equipping them with knowledge about NTDs and their impact, they can help to shift attitudes, reduce stigma, and encourage action. Educational programs and youth-led initiatives should be designed to bring these issues into the mainstream, ensuring that NTDs remain a priority in national and global health agendas. Strengthening health data systems for better decision-making. One of the critical elements that contributed to Niger's success was its ability to track progress through robust data collection and monitoring systems. For other countries working to eliminate onchocerciasis or other NTDs, establishing strong health data systems will be essential for making informed decisions, adjusting strategies, and ensuring that interventions are effectively reaching at-risk populations. Investing in health information technology and electronic health systems will enable countries to track disease prevalence and monitor the success of interventions in real time. This can help identify gaps in coverage, such as areas that are underserved by health services, and address them quickly. Real-time data can also inform decisions about the allocation of resources, ensuring that efforts are focused where they are most needed. Furthermore, countries should be encouraged to share health data across borders to facilitate coordinated regional responses. For diseases like onchocerciasis, which often transcend national borders, cross-border data sharing is critical. Regional health organizations such as the African Union or the Economic Community of West African States, ECOWAS, can play a role in fostering these collaborative efforts, ensuring that data flows seamlessly between countries and that interventions are synchronized, sustaining global political and financial support for NTD programs. The global health community has played a significant role in Niger's success, but to continue the momentum, ongoing political and financial support will be required. Global health commitments must remain strong, especially as many African countries face new and emerging health challenges. The international community must recognize that the success of NTD elimination is not only a public health achievement, but also a development one. By continuing to invest in NTD programs, both politically and financially, we are contributing to the broader goals of poverty reduction, economic growth, and social stability. One key area of focus will be ensuring sustainable funding for NTD programs, which often struggle to maintain consistent support due to changing political priorities or economic fluctuations. Multilateral organizations, donors, and governments must continue to increase funding for NTD programs, especially in regions like sub-Saharan Africa, where the burden is the heaviest. Financing should be focused on maintaining interventions that have already shown results, such as mass drug administration campaigns, surveillance, and vector control. These programs should not be abandoned once a country has made progress in eliminating one disease. They must be continuously supported to prevent relapses and protect gains. Additionally, as new treatments and technologies become available, funding must also support their introduction and integration into existing health systems. Addressing the environmental determinants of health, a major factor contributing to the spread of onchocerciasis and other NTDs, is the environment. The presence of black flies, which transmit onchocerciasis, is closely linked to water bodies such as rivers, where the flies breed. Therefore, addressing the environmental determinants of health is essential for long-term disease prevention. Countries must invest in improving environmental conditions to reduce the breeding grounds of the vectors responsible for the transmission of NTDs. This could include environmental management strategies, such as controlling water sources where vectors breed, or improving sanitation to reduce the risk of other diseases like schistosomiasis, which also thrives in waterlogged areas. Furthermore, climate change has the potential to affect the spread of NTDs. as changing weather patterns can influence the distribution of vectors and increase the risk of diseases spreading to new regions. As part of their health and development strategies, African countries must incorporate climate resilience into their NTD programs, ensuring that health systems are prepared for the changing environmental challenges posed by climate change. Building resilience in communities. While national and international efforts are crucial, community-level resilience is equally important. Niger's success in eliminating Onchocerciasis is partly due to the resilience of local communities. WHO were involved in health education and mass drug administration programs. For NTD programs to succeed in the long term, it is essential that communities themselves are equipped to handle future health challenges and sustain their own health systems. Community health workers, volunteers, and local leaders must continue to play an integral role in future NTD elimination programs. By engaging these key stakeholders, governments can help build trust and ensure that public health interventions reach even the most remote areas. In turn, communities will become more capable of responding to health threats, with the capacity to provide health education, distribute medicines, and monitor disease transmission. Moreover, community resilience can be enhanced by addressing broader social determinants of health, such as improving access to education, income, clean water, and adequate housing. When communities have the resources they need to thrive, they are more likely to be proactive in protecting their health and supporting public health initiatives. The future of NTD elimination in Africa. Niger's successful elimination of Onchocerciasis represents a turning point in the fight against neglected tropical diseases. As the first country in Africa to reach this milestone, Niger has not only demonstrated that NTDs can be eradicated, but has also set an example for others to follow. The road ahead is filled with opportunities to build on Niger's success and expand NTD elimination efforts across the continent. Through continued investment in research, strengthening of health systems, enhanced community engagement, and sustained political and financial support, Africa can make significant strides in eliminating NTDs. The lessons learned from Niger's journey will be instrumental in guiding other countries and ensuring that NTDs become a thing of the past. The international community must remain committed to supporting these efforts, understanding that eliminating NTDs is not just about eradicating diseases, but about improving the quality of life, reducing poverty, and contributing to the socio-economic development of entire nations. By maintaining the momentum generated by Niger's success, we can move closer to the vision of a healthier, more equitable Africa, free from the burden of neglected tropical diseases. Fostering multi-sectoral approaches to NTD elimination. For NTD elimination efforts to be truly effective, they must go beyond the health sector. NTDs are deeply intertwined with socio-economic factors such as poverty, lack of access to clean water, sanitation, and education. Therefore, a multi-sectoral approach is essential to address the root causes of these diseases. Niger's success in eliminating onchocerciasis has shown that when health programs are integrated with broader development strategies, they have a greater and more lasting impact. Ministries of education, agriculture, water, and sanitation must work together with health ministries to create an environment that prevents the spread of NTDs. For example, improving water infrastructure to reduce contamination, expanding access to sanitation, and promoting hygiene can significantly reduce the transmission of waterborne diseases like schistosomiasis and trachoma. Additionally, poverty reduction strategies are integral to addressing the social determinants of health that drive the persistence of NTDs. When communities have access to economic opportunities, stable incomes, and better living conditions, they are better able to prevent and treat diseases. This highlights the importance of integrating health interventions with efforts to reduce inequality and promote sustainable development. Innovative health financing models for NTDs. As African countries push forward with NTD elimination, securing funding remains a critical challenge. While traditional funding sources, including donor support and government budgets, have been essential, they are often unpredictable and insufficient for scaling up efforts. Innovative financing mechanisms such as development impact bonds, health financing pools, and private-public partnerships offer opportunities to mobilize new sources of capital for NTD programs. These financing models can attract private sector investment while ensuring that funds are used effectively to address NTDs. For example, Impact bonds can link funding to measurable health outcomes, motivating donors, governments, and private investors to support NTD programs that deliver tangible results. Moreover, Africa should explore alternative financing mechanisms, such as tax reforms and social impact bonds, that can create sustainable domestic sources of funding for NTDs. Building local funding mechanisms will ensure that African countries have the financial independence to tackle NTDs without relying solely on international donors. Building partnerships with the private sector. In addition to funding, partnerships with the private sector will be key to scaling up NTD programs. The private sector has the capacity to bring innovation, efficiency, and resources to NTD elimination efforts. Pharmaceutical companies, for example, have been instrumental in providing medicines for free or at reduced costs, as seen with Merck's donation of ivermectin for Onchocerciasis control. Private companies involved in water, sanitation, and infrastructure development can also play a role in improving health outcomes. Partnerships with technology companies can help develop tools for better disease surveillance, diagnostics, and treatment delivery. By harnessing the expertise and resources of the private sector, African countries can significantly enhance their efforts to eliminate NTDs and create more sustainable health systems. Strengthening regional health institutions. Regional health institutions are critical for coordinating efforts across borders and providing technical support to countries facing similar challenges. The African Centers for Disease Control and Prevention, Africa CDC, plays an essential role in supporting countries to implement NTD control programs and monitor progress. Furthermore, regional bodies like the West African Health Organization, WHO, and the Economic Community of West African States, ECOWAS, can facilitate cross-border collaboration in the fight against NTDs. This is particularly important for diseases like Onchocerciasis, which are transmitted through shared ecosystems, such as river systems, that cross national borders. Regional coordination ensures that countries work together, share resources, and align their strategies for maximum impact. In strengthening regional health institutions, the African Union, AU, and other regional bodies must ensure that they have the technical capacity, funding, and political support to effectively coordinate disease elimination programs across multiple countries. As part of the African Union's Agenda 2063, the fight against NTDs should be prioritized, and regional health initiatives should be integrated into broader development goals. Harnessing technology for data-driven decision-making technology will play a pivotal role in the ongoing fight against NTDs in Africa. One of the key challenges faced in NTD elimination is monitoring the effectiveness of interventions and tracking disease prevalence in real time. To overcome this challenge, African countries must invest in data collection and surveillance technologies that enable health systems to respond quickly to changing disease dynamics. Mobile health applications, Geographic Information Systems, GIS, and remote sensing tools can significantly enhance disease surveillance, improve early detection, and help allocate resources more effectively. These tools enable health workers to gather, analyze, and act upon real-time data, which can help prevent outbreaks and ensure that interventions are targeted where they are needed most. Additionally, artificial intelligence and machine learning can be used to predict disease outbreaks and optimize resource allocation. These technologies offer new ways to enhance decision-making, improve program efficiency, and ensure that health interventions are reaching the communities that need them most. Community-led health programs for sustainable NTD control. While top-down approaches to NTD elimination are essential, community-led programs are equally important for ensuring the sustainability of these efforts. Niger's success in eliminating Onchocerciasis relied heavily on community health workers and local leaders. WHO were deeply embedded in the communities they served. These individuals provided vital support in distributing treatment, conducting health education, and monitoring disease prevalence. Empowering local communities to take ownership of their health is critical for the long-term success of NTD programs. Community health workers can continue to play an essential role in sustaining NTD elimination by providing ongoing education, conducting routine health checks, and facilitating the distribution of medicines. Ensuring that these workers are well-trained, adequately supported, and compensated will enable them to continue providing essential services. Furthermore, fostering community ownership of health programs can help build trust between health systems and the populations they serve. When communities are involved in the planning, implementation, and evaluation of health interventions, they are more likely to engage with and support these initiatives, ensuring their long-term effectiveness. Empowering women in NTD elimination. Women play a vital role in NTD control and elimination, both as caregivers and health advocates within their communities. In many African societies, women are often the primary caregivers for children and the elderly, making them integral to the success of public health programs. Empowering women in NTD efforts ensures that interventions are more inclusive and tailored to the needs of those WHO are most affected by the diseases. In Niger, as in many other African countries, women have been key in the distribution of medicines, educating other women about the importance of NTD prevention and supporting the treatment of their families. To build on this, it is crucial to continue investing in the empowerment of women, particularly in rural areas where NTDs have the most impact. This includes providing women with access to education, healthcare, and leadership opportunities that allow them to take on more active roles in the fight against NTDs. Transforming Africa's health landscape. The success of Niger in eliminating Onchocerciasis is a transformative moment for Africa. It marks the first step toward a continent free from neglected tropical diseases and sets the stage for broader health and socio-economic improvements. By scaling up this success through community engagement, stronger health systems, innovative financing, and cross-border cooperation, Africa can continue to make progress in eliminating NTDs. The lessons learned from Niger's journey offer invaluable insights for other African nations and the global health community. To ensure that the future of NTD elimination is sustained, all sectors, government, community, international organizations, and the private sector must work together in a coordinated effort. A future free of NTDs is within reach, and Niger's success is proof that with the right investment, leadership, and collaboration, Africa can achieve this goal. By prioritizing health, equity, and sustainable development, the continent can break free from the grip of neglected diseases and unlock its full potential for growth and prosperity. Expanding the scope of NTD elimination, integrating with broader health and development goals. As African countries move toward eliminating NTDs, it's crucial to recognize the interconnectedness of public health, economic development, and environmental sustainability. The success of Niger in eliminating onchocerciasis offers a powerful lesson on how disease control can contribute to broader development outcomes. Eliminating NTDs not only improves health but can also catalyze social and economic growth by reducing disability, enhancing productivity, and increasing educational attainment. By aligning NTD elimination efforts with broader development goals, countries can ensure that progress in public health translates into tangible benefits for all sectors. For instance, improving access to water and sanitation, key factors in controlling diseases like schistosomiasis and trachoma, can also help achieve broader SDGs related to clean water and sanitation, SDG 6, and poverty alleviation, SDG 1. Similarly, integrating NTD programs with agricultural development, infrastructure, and education initiatives will help create a more holistic approach to health and development. Governments and international organizations should work together to integrate NTD programs into the wider framework of national development plans. This will help ensure that NTD elimination remains a priority even as countries focus on other health and economic challenges. For example, by linking NTDs with maternal and child health, poverty reduction, and sustainable agriculture, countries can achieve multiple health and development goals simultaneously. Strengthening health systems, the backbone of sustainable disease control. A strong and resilient health system is the foundation of successful NTD elimination efforts. While Niger's success was driven by targeted interventions for onchocerciasis, it also relied on a robust health system that could support mass drug administration, surveillance, and ongoing disease control efforts. To ensure that progress is maintained, other African countries must strengthen their health systems by improving healthcare infrastructure, enhancing the capacity of health workers, and expanding access to essential medicines and diagnostics. Health system strengthening should include improving health workforce training, ensuring that frontline health workers have the skills and knowledge to implement NTD programs effectively. It also means investing in health infrastructure, particularly in rural and underserved areas, so that people can access treatment and care when they need it. Building a resilient health system also requires improving disease surveillance systems, which allow for early detection and response to new outbreaks or challenges. In addition to strengthening traditional health systems, countries must invest in the digital health revolution. Technology can support better data collection, real-time monitoring of disease trends, and more efficient management of resources. For instance, mobile health platforms, electronic medical records, and remote diagnostics can improve service delivery, particularly in remote or hard-to-reach areas. Integrating digital tools into NTD programs will enhance the responsiveness and effectiveness of health systems. The role of regional and global cooperation. While national efforts are essential, regional and global cooperation is indispensable in the fight against NTDs. Onchocerciasis, like many other NTDs, does not recognize national borders, making cross-border cooperation a critical part of any elimination strategy. Niger's success should serve as a model for greater regional collaboration among neighboring countries. This collaboration can involve sharing resources, data, and expertise, and coordinating mass drug administration and vector control programs. Regional health bodies, such as the African Union, AU, the Economic Community of West African States, ECOWAS, and the African Centers for Disease Control and Prevention, Africa CDC, should be empowered to facilitate cross-border coordination. These organizations can play a vital role in harmonizing policies, aligning national strategies, and providing technical and financial support to countries engaged in NTD elimination. At the global level, partnerships between African governments, the World Health Organization, WHO, and donor organizations like the Bill and Melinda Gates Foundation are essential for providing the resources needed to scale up NTD elimination efforts. Global health actors must continue to advocate for greater funding for NTDs, ensuring that financial resources are available to sustain and expand current interventions. Increasing access to medicines and treatment. The provision of medicines is at the heart of NTD elimination programs, but ensuring access to these medicines is an ongoing challenge. In many African countries, particularly in rural areas, access to essential medicines can be limited due to infrastructure challenges, high costs, or supply chain issues. Niger's success in eliminating onchocerciasis relied heavily on the availability of ivermectin, provided free of charge by Merck. However, the future of NTD elimination across the continent requires more robust systems for ensuring equitable access to medicines for all. One critical approach to increasing access to NTD treatments is to improve the supply chain systems that deliver medicines to the most remote and underserved populations. Strengthening logistics and distribution systems, improving tracking mechanisms, and reducing delivery costs will ensure that medicines reach those WHO need them most. In addition, governments and international partners must work to ensure that essential medicines are available year-round, rather than just during the implementation of mass drug administration campaigns. Another key component is ensuring that countries have the financial means to procure and distribute these medicines. While donations from pharmaceutical companies have played a significant role, African governments must also allocate sufficient resources to ensure that they are able to maintain the availability of treatments long after external support has decreased. Empowering communities and encouraging ownership community involvement has been an essential factor in Niger's success, and it will be key in ensuring that NTD programs are sustainable in the long term. Community health workers, local leaders, and volunteers are crucial for distributing medicines, raising awareness, and monitoring disease transmission. To build on Niger's success, it is vital to empower communities to take ownership of their health outcomes. Niger's experience also underscores the importance of health education in encouraging behavior change and promoting preventative measures. Public health campaigns that focus on raising awareness about the causes, symptoms, and prevention of NTDs can help reduce stigma and increase community participation in health initiatives. As communities become more knowledgeable about the diseases they are fighting, they are more likely to engage in efforts to prevent transmission and improve health practices. In addition to educating communities, it is important to provide training for local health workers and volunteers, ensuring that they have the necessary skills and tools to carry out their roles effectively. These workers, many of WHO are from the communities they serve, are essential in sustaining NTD elimination efforts and ensuring that interventions are both culturally appropriate and responsive to local needs. Tackling the economic burden of NTDs. The economic burden of NTDs is significant, not only because of the direct costs of treatment and healthcare, but also due to the long-term impact on economic productivity. NTDs, including Onchocerciasis, can lead to disability, blindness, and other long-term health complications that affect individuals' ability to work, attend school, or participate fully in society. This reduces income generation, impedes economic development, and exacerbates poverty. Eliminating NTDs, therefore, has wide-reaching economic benefits. It frees people from the physical and social limitations imposed by disease, enabling them to contribute to their families and communities. As more countries eliminate NTDs, the long-term positive impact on economic growth becomes clear. Healthier populations lead to stronger workforces, increased productivity, and greater opportunities for education and economic participation. In addition to the direct economic benefits, the reduction of NTDs also helps improve social development indicators. By improving health, reducing stigma, and allowing people to contribute more fully to their communities, countries can see better outcomes in terms of education, poverty reduction, and overall well-being. Sustaining the momentum of NTD elimination. Niger's success in eliminating Onchocerciasis has paved the way for a brighter future in the fight against neglected tropical diseases across Africa. Through strategic partnerships, community involvement, political will, and a focus on long-term sustainability, countries can replicate Niger's success and eliminate other NTDs that continue to plague the continent. By building on the lessons learned, strengthening health systems, fostering innovation, and ensuring equitable access to treatment, Africa can continue to make progress in the battle against NTDs. With the global health community's support, African nations have the potential to transform their public health systems, reduce the burden of disease, and create healthier, more prosperous societies. The fight against NTDs is far from over, but the success of Niger serves as proof that with determination, collaboration, and a shared vision, Africa can reach the goal of becoming free from these debilitating diseases. By prioritizing NTD elimination and integrating it into broader development strategies, we can look forward to a future where the burden of disease no longer holds Africa back from realizing its full potential. Fostering collaboration across sectors for NTD success. The fight against NTDs requires a collective approach, where multiple sectors come together to address the root causes of these diseases and create sustainable solutions. While health systems are at the core of NTD control, sectors such as agriculture, education, water and sanitation, and housing play critical roles in ensuring the success of disease elimination programs. For example, the agricultural sector can contribute to disease control by reducing exposure to vector breeding sites, such as stagnant water bodies, while promoting safer farming practices. Similarly, improving access to clean water and sanitation through coordinated efforts between the water and health sectors can directly reduce the transmission of waterborne NTDs like schistosomiasis. The education sector must also be involved by ensuring that NTD awareness is integrated into school curricula and community education programs. Engaging children and young people as health advocates will empower the next generation to take ownership of public health and continue the fight against NTDs long after the current programs have been implemented. Empowering African leaders for a healthier future. African leaders play an indispensable role in shaping the future of health in their countries. Their decisions, policies, and commitment to improving public health will determine whether Africa can achieve the goal of NTD elimination and broader development outcomes. Considering Niger's success, it is crucial that African leaders take bold actions to prioritize NTDs on national and regional agendas. Leaders should ensure that NTD programs receive consistent funding, integrate NTD elimination into broader health and development plans, and champion policies that promote equity and access to health services for all citizens. By committing to NTD elimination as part of their long-term vision for Africa's development, leaders can help unlock the potential of millions of people, leading to healthier, more prosperous nations. Moreover, African leaders must continue to build regional partnerships and collaborate with international stakeholders to share knowledge, resources, and best practices. Coordinating efforts at a regional level will help address cross-border challenges and ensure that disease elimination is not interrupted by national boundaries. Advice to African leaders. To truly eliminate NTDs and build sustainable health systems, African leaders should 1. Prioritize public health. Recognize the importance of public health in driving economic and social development. Make NTD elimination a national priority and allocate resources accordingly. 2. Strengthen regional cooperation. Foster partnerships and collaborations with neighboring countries, ensuring that disease control efforts are synchronized across borders. NTDs do not recognize national boundaries, so regional cooperation is essential. 3. Engage communities. Invest in community-based approaches to health. Empower local health workers, leaders, and community members to take ownership of NTD programs to ensure their success and sustainability. 4. Invest in health systems. Strengthen health systems to ensure they can sustain long-term disease control efforts. This includes improving healthcare infrastructure, training health workers, and making essential medicines widely accessible. 5. Foster innovation. Support research and innovation in diagnostics, treatments, and disease control strategies. Embrace digital health solutions and technologies that can improve disease surveillance and monitoring. 6. Advocate for global support. Leverage Africa's collective voice to advocate for more financial and technical support from international organizations and donors. Highlight the importance of NTD elimination in achieving sustainable development goals. 7. Focus on equity. Ensure that NTD programs are inclusive, addressing the needs of marginalized and vulnerable populations. Focus on reducing health disparities and promoting health equity across the continent. Summary of key messages. Niger's success in eliminating Onchocerciasis is a transformative achievement that highlights what is possible when countries, communities, and international partners work together. Key to this success were sustained political commitment, strong community involvement, international collaboration, and effective disease control strategies. African countries can build on Niger's success by integrating NTD elimination into broader health and development strategies, prioritizing equitable access to health care, and ensuring that health systems are resilient and well-resourced. The road ahead requires continued investment in research, health infrastructure, and the empowerment of local communities. African leaders have a critical role to play in ensuring that NTDs remain a priority on national and regional agendas, fostering cooperation across borders, and securing the financial and political commitment necessary for long-term success. With a collective and sustained effort, Africa can achieve the goal of becoming free from neglected tropical diseases, unlocking the potential for a healthier, more prosperous future for all. Thanks for watching. Niger's victory in eliminating river blindness is a huge step forward for Africa, but the journey is far from over. If you enjoyed this video, don't forget to like, share, and subscribe to the Bold African Voice, BAV, for more in-depth analysis on the issues that matter most to Africa's future. Leave your thoughts in the comments below and let's keep the conversation going. Together we can shape a healthier, stronger Africa.